Let's get more on our top story now. Children in England are getting second-rate dental treatment compared to those in Scotland and Wales. That's according to the British Dental Association.
This is after new analysis of NHS data, which found that children and teenagers had almost 43,000 hospital operations to remove teeth in England last year. It works out at 170 operations a day, a 17% increase in the last 4 years.
The BDA says children in England are receiving second-class service when it comes to their oral health because, unlike Wales and Scotland, there's no dedicated national programme to tackle the problem. In response, the Department of Health and Social Care say over half of all children in England visited a dentist last year, and it's introducing a sugar tax to tackle tooth decay.
We can talk to Claire Stevens, who's president of the British Society of Paediatric Dentistry. Joins us now. Good morning.
Good morning.
I can imagine if these figures, anyone who hears these figures are going to be pretty shocked. 43,000 tooth operations on teenagers and children, 170 a day. Why is this situation at this point? And I'm presuming it's worsening.
The numbers of operations are going steadily up and, as you say, have gone up by about 15% in the last 4 years. But the reason isn't just one single answer. It's about our children and young people having too many sugary foods and drinks, particularly in between meals. It's also about not getting enough fluoride onto the teeth, so making sure that parents know to brush their children's teeth with a fluoride toothpaste twice a day, last thing at night and at one other time. And, of course, it's also about getting children into the dentist in the first place. Children should be taken to a dentist as soon as their first teeth come through, certainly receiving their dental check by their first birthday, and then at least every year thereafter. 40% of children in England didn't see a dentist last year.
So, just to be clear with people, you're a dental surgeon.
I am, yes.
That is what you do, your day job in a hospital in the northwest of England. So
yes.
give us a snapshot of who you're treating or what you're seeing.
So I have a routine operating list where I will be removing multiple decayed teeth under general anaesthetic. So these are children where their needs are so complex or extensive that they're not able to be managed in a practice setting. I have had to remove all decayed 20 baby teeth under general anaesthetic for a 2-year-old child, and that's not a rare occurrence. That's something that's happening for me week in, week out.
Sorry to interrupt you. When that happened,
yes.
Was that the first time that child had seen a dentist? Was this directly as a result of poor nutrition and poor teeth care, dental care?
So this would be a child that presents to their dentist the first time because they're in pain. The dentist will recognise quite rightly that this is beyond their remit to manage in a high street dentist, will refer to me, and that first dental experience for a child will be a traumatic procedure under general anaesthetic. Wouldn't it be great if the first time that child came into a dentist, it was a positive, happy experience where we could support the family, give preventative advice, help with weaning, and then make sure that child remains decayed teeth for the rest of their life.
You talk, as I understand, as well about teenagers who are having to have all their teeth, false teeth at the age of, in their early teens.
That's right. You know, we know that children and young people are consuming far too many sugary foods and drinks, and for teenagers it's often fizzy drinks. Many of them are drinking these daily or more regularly. I've had to have young people where we've removed so many permanent teeth that I have no option than to provide them with false teeth, and that could include false teeth. Imagine how that person is going to manage for the rest of their life without the natural teeth.
So what's the answer then? Where does because something's happening if 40% of children aren't visiting a dentist, that some message is not getting through. Where is it falling down, the system?
I think there needs to be top-down measures. We're having the sugar levy, which I certainly welcome, which is going to be introduced in a few months' time. But how about investing some of that, the income that will be generated in preventing dental disease in the first place? In Manchester here, we have a regional programme of prevention. We've recognised the need to invest in these schemes, supervised brushing in early years setting, reception, and even earlier than that. We're giving out free toothbrushes and toothpaste as part of the health visitor checks at 6 months and 2.5 years. We're encouraging families into the dentist, and then we're trying to keep them there, and we're making sure that we apply fluoride. We know that we will save far more money than we're investing, but it's important that we're putting prevention first.
Can I just ask, people hear the, number one, the expertise you have, the passion you have. It's hard to escape the fact that if a child hasn't seen a dentist, there is only one person to blame for that, isn't there? And that has to be the parent.
I don't like the word blame.
Well,
Charlie.
okay.
I really don't like
Remove
the
word blame then, but I mean, the only responsibility is for the parent to take the child to a dentist, and you must meet people who've brought their children to have their teeth removed because they haven't done that.
Of course that parents, and I speak as a parent myself, you know, of course parents have responsibility, but the profession also has the responsibility to educate the family so that they know that you need to be taking a child as soon as the first teeth come through. I do think, though, that, you know, we need to make it easy for children to come into our services, and that might mean working with school visitors, with health visitors, to make sure that we're getting children into the system and then keeping them there.
I mean, you're taking a very measured response to this. Do you really think that people don't know their children have to clean their teeth or go and see a dentist? Do you really think people don't know that?
I don't think that... Well, there has been research that shows that parents don't realise, A, how early you should come, and also the fact that it's free. I mean, I found that quite astonishing, that parents weren't aware that actually NHS dental treatment was free for children. And so there may be barriers that parents perceive are there when actually they're not there in reality.
Claire Stevens, thank you very much for your time this morning. Claire Stevens is president of the British Society of Paediatric Dentistry and a dental surgeon herself.